the mayor of Seoul, the capital Seoul, Park Won-soon, has sued him and other leaders of that church for murder and injury because he is accusing the leader, Lee Man-hee, of not giving out proper information, accurate information in the first stage. Because when this first broke earlier, about 2 weeks ago, before that, South Korea only had a few cases, but it was because of this one church member, so-called the super spreader here, that South Korea right now has thousands of patients of this coronavirus. And that's why the Seoul mayor is accusing him. And even now, the Seoul mayor and other here in South Korean authorities are trying to figure out more about this church because they are finding that the information they have received from the church are not accurate. And the names of the people there, the church has been saying that, they are cooperating with the government authorities here, but the government authorities are finding it very difficult right now to seek out all the members. Right now, the government authorities says that they have interviewed more than 330,000 church members, but they're still looking into the church members as the number of the patients continue to rise here. And so, yes, he did go down in his knees and he did apologize, but there are lots of criticisms out there saying that he is to be blamed for this. So we'll have to see whether he will be going in for questioning. But right now, the church says he did test for the virus, came out negative, but the South Korean authorities don't believe that. And so apparently the authorities have also conducted a test on him. They're waiting for his results.
Right, Yoon-suk, and as the number of cases continues to escalate in South Korea, we understand the city of Daegu is suffering from a shortage of hospital beds, meaning that some of these patients are having to fend for themselves. I mean, how are officials combating this issue?
Well, definitely, yes. I mean, there is a shortage of beds. And a few days ago, apparently, for example, there were more than 1,000 patients, and yet they were not able to be admitted to the hospitals. And only about less than 500 were admitted to hospitals. But at that time, it was like a first come, first basis. I mean, they took in anybody who had the symptoms, but they realized that everybody who was sent back home to be self-quarantined were not able to do that. And so the patients who died from this in recent days were people who were being self-quarantined at home and who had severe symptoms. And so the South Korean government has come up with a new guideline saying that not everyone who has the symptoms will now be admitted to a hospital. They have been categorized into 4 different groups. And so those with, small symptoms, with little symptoms, will now be put in non-medical state facilities. They will be monitored. They will be checked. But that will allow more of the severe symptoms, those patients with the severe symptoms, to be admitted to hospital. They're hoping that this will be able to help Daegu fight this virus. Also, they're coming out with this drive-through facilities, like, how you would drive through Starbucks and McDonald's. Right now, what you can do is you can drive through and you'll have a nurse in this full, protective suits wearing masks, and they will be carrying out the test while you stay in the car. They'll check your temperature. They'll use swabs to get samples from your throat, your nasal passages, and with that, they'll be carrying out the test. And doctors are saying this is much efficient because there'll be less contact between the so-called possible patient and the medical staff, and also it's much quicker because remember, South Korea has already carried out about tests for about 100,000 people. They're conducting tests to thousands of South Koreans. They can't do that all inside the hospitals, and so hopefully this will help Daegu fight this coronavirus.